I'd like to say a few words about short sight, the treatment of short sight. And here I'm referring to short sight which is changing. If somebody is born with short sight, it's very difficult to do anything about. Or if they've been short-sighted for many years and that's how it is, then that's difficult to change. But frequently you get patients coming to you who have progressive short sight. For one reason or another, the short sight is getting worse. This may happen in 9 or 10-year-olds, for example, or it can happen any other time of life. Recently I had a 50-year-old who was getting progressive short sight. Now, in the case of a 9 or 10-year-old, if they were seeing well before, but suddenly they need to use spectacles, then by timely treatments, you can there's a possibility that they don't need to use spectacles at all. And if, on the other hand, without any treatment or anything, then there's the danger that they will need to use spectacles for the rest of their life. As far as older age is concerned, if the short sight is getting worse all the time, then there is the danger of real damage to the eyes. So whereas a short sight of 2 or 3 diopters, it's okay, most people can live with that. If this progresses to 10 diopters or even 12 diopters, there is a real danger that the tension in the eye caused by this will lead to retinal detachment and consequently to blindness. So there's a very real pressure, a very real need to treat the short sight. Now, it's been my observation that when people start to get short sight, when the short sight gets worse, it's always because of some measure of tension. There's always tension is causing it. It may be fear or it may just be tension. And so in order to treat it, first of all, you need to treat the tension. And in order to treat the tension, you need to go some way towards finding the cause of the tension. So in a school child, for example, the tension may be due to not getting on with their teacher or being bullied. Or in an adult, you may have a similar sort of thing, that they feel unable to do the job which they have been given. So recently I had a patient who had moved from London in the hopes of having a quieter life, but in practice the job that she took up, which was a teaching job, was much, much more stressful than before. And since she was now in her 50s, she felt some unease and some disquiet about her ability to actually do the job. So finding this is important, because if you can't resolve this issue, then you can't resolve the short sight either. So that's the one thing. The second factor in it is that short sight occurs because the qi in the eyes has become weak. And so here you need to look at the reason why the qi in the eyes has become weak. In children, it may be simply due to qi weakness, they're tired, they're overworked, or it may be they're going through a growth spurt. And when you go through a growth spurt, then the kidney energy can become somewhat weak, and this also can affect the eyes. Or it may be due to a lingering pathogenic factor which is obstructing the flow of qi to the eyes. Determining the factor which is preventing the qi from flowing well to the eyes will provide the key to treatment. In adults, you may see, once again, you may see qi weakness, you may see stagnation of qi, liver stagnation, or you may just see general tension. It's not a proper Chinese term, but well, we all know what it is, just general tension and anxiety and general ill health. Making the patient healthier is the other factor in treating short sight. And so I don't want to go into the details of the things which can obstruct the flow of qi to the eyes. They're so many and varied that it's really up to the skill of an acupuncturist. Anybody who has experience with treating patients of any kind will now know what to look for. Just what is it that's obstructing the flow of qi to the eyes? And so the basic treatment would be ones to bring qi to the eyes, and the patient can do it themselves with the massage techniques which we show, or you can do it by stimulating these same points with these are like large intestine 4 and gallbladder 20, and possibly some points around the eyes like stomach 1 or bladder 1. These are typical points which can be used for bringing qi to the eyes. Liver 3 combines well with large intestine 4 for reducing general tension as well. So that's a combination which is often helpful for adults. I should say also that if these treatments or the acupuncture treatment is not successful, then you should encourage the patient to look into the Bates technique, because after all, the Bates technique was developed by Bates when he had this very condition. He was going blind because of extreme short sight.